Friends and colleagues, welcome to the CME certificate course in Management of Gestational Diabetes Mellitus. This is the first module and it covers the basic considerations in the management of gestational diabetes mellitus. This slide shows you the learning objectives. And the learning objectives of this module are to understand the concepts about the definition and classification of gestational diabetes. Then we discuss the epidemiology. We also discuss the pathophysiology. And then we go on to discuss the maternal and fetal complications. Now this slide also looks at the points for discussion, and now we are going to talk about the first point, which is definitions. After definitions, of course, we'll go on to the epidemiology and risk factors, the glycemic changes in normal pregnancy and in gestational diabetes mellitus, placental, fetal and maternal consequences, and the postpartum changes in physiology. Now let's look at the definition as shown in this slide. Now, gestational diabetes, as earlier, was generally defined as any degree of glucose intolerance that was first recognized during pregnancy, regardless of whether the condition may have predated pregnancy or may have persisted after pregnancy. But with the progress in the availability of clinical evidence, the newer guidelines have made the definition much more precise. So this slide shows us the new definition of gestational diabetes, and this is as per the American Diabetes Association's latest definition. In this definition, women who are diagnosed with diabetes by standard diagnostic criteria in the first trimester should be actually classified as having pre-existing pre-gestational diabetes. It could be type 2 or very rarely type 1 diabetes or monogenic diabetes. But if you diagnose diabetes by gestational diabetes criteria, that's called GDM when it's diagnosed in the second and third trimester. So gestational diabetes mellitus would be now diabetes that is diagnosed in the second and third trimester of pregnancy, and that's not a type of diabetes when it is not clearly pre-existing type 1 or type 2 diabetes. That's when you call it gestational diabetes. I think the main concern here is that if somebody has, for example, a fasting plasma glucose of say 140 in the first trimester, that is likely to be a pre-gestational diabetes. So that's a clinical impact of this new definition. And of course, if a lady who is not previously known to have diabetes is now diagnosed to have diabetes as per the gestational diabetes criteria in the second or third trimester of pregnancy, that would be called gestational diabetes. So this slide shows the scope of the course. In general, we will be covering gestational diabetes, and by gestational diabetes, of course, we are just setting the scope of the contents of the course. The course contents would cover the management of diabetes, which has onset or first recognition during pregnancy. But we will also be having an additional module on pre-gestational diabetes, which would not be strictly part of the course criteria, but a bonus module on pre-gestational diabetes would be added to the scope of this course.